Welcome to How to Accommodate a Patient's Request to Access the Health Record. I'm Dr. Michael Warner with Patient Advocacy Initiatives. Before we get started, please answer 3 quick questions. The privacy rule, also known as the Standards for Privacy of Individually Identifiable Health Information, became the final rule of HIPAA in 2002. HIPAA, as you recall, is the Health Insurance Portability and Accountability Act of 1996. Compliance with HIPAA privacy rule was required as of April 14, 2003. The first compliance date was for larger practices and health systems. Small medical practices were given an additional year to comply, meaning that all providers needed to accommodate a patient's right to request to access the health record by April 14, 2004. Code of Federal Regulations, Title 45, which is Public Welfare, Part 164, Section 524, showcases the patient's rights. Patients have a right to request access to their health record. If a person is an authorized personal representative of the patient, then this person is to be treated the same as if he or she is the patient. As mentioned earlier, Meaningful Use 2 standards limited the amount of health record information that was required to demonstrate EHR patient portal function. Many patients have accessed their health records through the portal and have likely assumed that they were looking at the entire health record. In order to see the rest of the health record, which also includes history of present illness, review systems, and some of the past family social history, patients need to officially request access to the health record. As originally planned, Meaningful Use Stage 3 was to have gone effect in 2016. Stage 3 would have required the patient portal to disclose the entire health record. MACRA, the Medicare Access and Chip Reauthorization Act of 2015, has consolidated and streamlined the process of tracking provider quality. Though MACRA absorbed Meaningful Use, patient electronic access is still an objective. Now, the word access encompasses the intent of the law, but descriptors like read and review better capture the patient action. For patients today, the hardest part about accessing the health record is getting the record in their hands or in front of their eyes. Soon, the entire record will be available for anyone who has access via the Secure Patient Portal. Access, reading, reviewing of the health record is intended for everyone in our society. In late March 2016, the Federal Communications Commission, FCC, approved a plan to expand phone subsidies to people with low incomes to include internet service. Experts cited a digital divide among those who can afford internet service versus those who cannot. This subsidy was approved because an estimated third of low-income households do not have internet access because of the cost. With regards to healthcare, this internet subsidy helps our citizens exercise their right to access their health information. Providers must either grant or deny the patient's request to access the healthcare record within 30 days. Within this time frame, the provider must also give the patient written notification of their response. As mentioned previously, some healthcare records are HIPAA exempt. They include psychiatric notes and most workman compensation and motor vehicle accident records. Though psychiatric notes are prohibited from patient access, recent changes to the law now allow mental health providers to share information with the National Instant Criminal Background Check System. This change in the HIPAA privacy rule was part of a January 2016 executive order by President Barack Obama to help curtail gun violence. If a patient wishes to complain about trouble with gaining access to the health record, he or she may contact the Office of Civil Rights. The Department of Health and Human Services and the Office for Civil Rights, OCR, oversee compliance with the privacy rule. The OCR is responsible for enforcement, which includes complaint investigations and compliance reviews. The OCR is also empowered to assign civil money penalties and criminal prosecution. A government online complaint portal and toll-free telephone support number exist to receive complaints and initiate investigations. To access patient records, providers may charge a customary fee to cover the photocopy cost and postage. The law prohibits adding additional fees for the time it took you to locate the record. Because our government wants our records to be electronic, the record, after all, should be a few keystrokes away and not on a shelf or in a storage unit. Soon, most access to health record issues will vanish as patient portals allow full disclosure. In regards to your practice, you want to make sure that all staff members respond accurately and consistently. You do not want your staff members to have varied interpretations of federal law, especially when you are the one responsible. While some of the patients may complain to the OCR about access issues, most will come to you with their difficulties. It all comes back to you and how you accommodate the patient's rights. I thank you for participating in this module. In the next module, we will address rules governing the patient's right to request to amend the record. Kindly first answer these quick questions.